In this video, I will go over the histology of the GI tract and discuss the findings that is specific to each of these segments. So there are four main layers in the GI tract, and these include the mucosa, which contains the epithelium that is required for absorption, as well as lamina propria, which is required for support, and finally the muscularis mucosa, that is required for motility. The layer underneath is called submucosa, so this is the submucosa, and it contains the connective tissue that is required for support, as well as the blood vessel. So here you can see that there is a blood vessel that is running in the submucosal layer. In addition, they have ganglia that are called Meissner plexus, so-called Meissner plexus, also known as submucosal plexus, and is required for regulating secretion. And the way I memorize it is that Meissner is required for regulating secretion. The next layer is the muscularis externa, which contains ganglia that are required for peristalsis. And these ganglia are called Auerbach or myenteric plexus, and they regulate motor activity or peristalsis. And so the way I memorize it is that myenteric plexus is required for motor activity. And then the final layer is the adventitia or serosa, which acts as a protective barrier. Now let's go back to this table and fill it out together. So different segments of the GI tract have different rates of peristalsis. And so in other words, there are pacemaker cells, which are called interstitial cells of Cajal, which through gap junction send signal to the smooth muscles as well as the myenteric plexus to regulate peristalsis. And you will have to know that ileum has 8 to 9 waves per minute, duodenum has 12 waves per minute, and stomach has 3 waves per minute. So the way I memorize it is that the letter I is the 9th letter, so A, B, C, D, E, F, G, H, I. 1, 2, 3, 4, 5, 6, 7, 8, 9. So it's the 9th letter. So that's how I memorize that ileum has 8 to 9 waves per minute. And then for duodenum, it always reminds me of D goes for dozen. So there are dozens of waves per minute with duodenum. So that's how you can memorize the rates of basal electric rhythm in different regions of the GI tract. Now, as for the histology, stomach contains the gastric glands, which contains 3 types of cells that you will have to be familiar with. So the first cell is the parietal cells. Then we have the chief cells. And then finally we have the mucosal cells. So parietal cells have 2 functions. One of its function is to secrete stomach acid or H+, and then its other function is to secrete intrinsic factor. So intrinsic factor is a protein that binds to vitamin B12 and then helps it to get absorbed in the ileum. Now, if there is an autoimmune disorder that causes destruction of the parietal cells, as a consequence of which intrinsic factor will be deficient, these patients will develop anemia due to B12 deficiency. And this condition is referred to as pernicious anemia. I would also like you to know that H+ secretion is regulated by different factors. So factors that increase stomach acid secretion include histamine, acetylcholine, as well as gastrin. And then factors that decrease stomach acid secretion include somatostatin, prostaglandin, as well as gastric inhibitory peptide. So as you know, NSAIDs like ibuprofen or aspirin can cause gastric ulcers, and the reason is that they inhibit prostaglandin, so there would be too much stomach acid secretion, which causes stomach ulcers. On the other hand, there are medications that will block histamine H2 receptor. An example of these medications include ranitidine or cimetidine, and thus they would decrease the secretion of stomach acid. The next type of cells I'm going to talk about are chief cells, and these cells are required for the secretion of pepsinogen, which later on, by stimulation via the stomach acid that is produced by parietal cells, it will be converted to pepsin, and then pepsin will digest proteins. And then again, you should know that increased vagal stimulation as well as increased local acid production will increase the production of pepsinogen by the chief cells. The last cells that I'm going to talk about are mucosal cells, and these cells will secrete bicarbonate to help protect the mucosal layer of the stomach. So therefore, the mucosal layer of the stomach, because it has HCO3, will be able to neutralize stomach acid. The next part of the GI tract is the duodenum, and this segment contains Brunner glands. And the function of Brunner glands is to secrete bicarbonate in order to protect the duodenum from stomach acid, and it also will lubricate the intestinal wall. So here is an image of the duodenum, and as you can see, there are submucosal layers of the Brunner glands which will produce HCO3. The next segment of the GI tract is the jejunum, which contains the crypts of Liberkine. So here you can see the crypts of Liberkine, as well as the plica circularis, which are referred to the crescentic folds of the mucosa. So let's go back to the table. So here we will have plica circularis, as well as crypts of Liberkine. I would skip ileum for now. I will refer to it later. Then I would like to move on to the colon. So colon contains numerous goblet cells but no villi. So there are crypts with numerous goblet cells but no villi. And then the reason I didn't want to talk about the ileum is that it has a component of both the jejunum and the colon. So the ileum contains plica circularis, crypts of Liberkine, and then it also contains the largest number of goblet cells in the small intestine. And then one other important component that is specific to the ileum is called the Peyer's patches, which secretes IgA against pathogenic organisms. And if I had to draw the Peyer's patches, it would be something like this. So then again, these are referred to the lymphoid nodules that are specific to the ileum. And that concludes our discussion.